Hi, this is for the discussion board of Module 4, Depression in Children and Adolescents. The National Institute of Mental Health estimates approximately 11% of adolescents have a depression disorder by the age of 18. Early detection is the key to recovery and less chances of relapsing and/or reoccurrences. The goal is to live a happy, fulfilling life. The signs and symptoms are isolation, doesn't have friends, likes to be alone, no interest in activities or doesn't like those activities he or she used to enjoy, complains about being sick, doesn't want to go to school, anger, picks fights, is defiant, always irritable, exhibits disruptive behaviors, low self-esteem, oversensitive to rejection and/or failures, doesn't have friends, no one wants to be my friend, sadness, hopelessness, tearful, crying all the time, tired, always bored, poor concentration, poor performance in school and in sports, anorexia. We have to be cognizant of these signs and symptoms because if left unchecked, they can lead to drug and alcohol abuse, but worse, to suicide. Suicide is the third leading cause of death among children 15 to 19 years of age. In my clinic, we have an in-house therapist available immediately whenever we notice signs and symptoms and/or patients ask for a referral. This is very important because we have a large gay, transgender community, and as we know, one of the highest, especially with young adolescents and teenagers and young adults, is suicide because of being gay or transgender. The pathophys mechanism is, in doing my research for this week's discussion, I found that the exact cause of depression is still unknown. Research has been done to conclude serotonin as well as dopamine have a part in depression. These neurotransmitters are, simply put, messengers. If these messengers are not relaying the message, for whatever reason, whether organic, disease process, situational stressors, they are not staying long enough to register the message. This causes an imbalance, and the imbalances are manifested as the signs and symptoms of depression. The reasons are unknown. Research continues. As we know, the brain is the last frontier. The FDA has approved 2 SSRIs for the treatment of depression in children and adolescents. SSRI are selective serotonin reuptake inhibitors. There are 2, and excuse my pronunciation, fluoxetine, which is Prozac, for children 8 or older, or escitalopram, which is Lexapro, for children 12 or older. Education for the patient and their families must include 1. It may take up to 8 weeks for the medication to take full therapeutic effect. 2. Do not stop taking this medication. You should be tapered off slowly and only under provider supervision. 3. Be aware of the signs and symptoms of suicide ideations and/or behaviors. In the initial phase of taking these medications, the suicide risks may increase. How do they work? As described in our textbook, serotonin is a natural transmitter in the central nervous system that is found in high concentration in certain neurons in the brain and the spinal cord. The Mayo Clinic describes the function of SSRIs is to block the reabsorption of the neurotransmitter, the messenger serotonin, in the brain. Changing the balance of serotonin seems to help the brain cells send and receive messages, which in turn boosts mood. I hope this helps, and I'm looking forward to hearing from you guys. Have a great evening.